morning, everyone. Welcome to Coffee Chat. I'm Andy Bozarth, Director of Outreach and Advocacy here at AARP Kansas. And this morning I'm joined by Dr. Rita Stanley, and we're going to talk about functional medicine and diabetes. This is Diabetes Awareness Month, and we want to let you know a little bit more information and things you can do to help yourself. So good morning, Dr. Stanley. Thank you so much for joining us.
Well, it's so good to be here with you all. Thanks for inviting me.
Well, I really appreciate you taking time out of your busy schedule. I know that you are very busy and that we appreciate you.
Sure. Anytime.
I looked a little bit at your history, and you have a family history of service through medicine, and it's wonderful. So could you tell me a little bit about your family history and how you were drawn to medicine?
Yes. I grew up in Kansas City, Missouri, and I'm the third generation of physicians in the family. My grandfather and father, both from Alabama. And so, I shake my head when I think about my grandfather in those days. We're talking about the early 1900s where he was a physician. And I watched, every summer we went to Alabama, and I watched him take care of people, and then eggs and things would show up at the door. So, it was just a different time. So he served the community. And then my father did the same thing. He went to medical school in Howard, at Howard University. And of course, living in the household with him, he just modeled it, Andrea. I tell people I never heard him once say, "I want you to be a doctor," but I just watched him, and in my mind, that's what you did. So ultimately, I went to medical school in St. Louis, and so I'm honored. I'm humbled still after all these years at what they accomplished at a time, frankly, in Jim Crow South, what they accomplished. So whenever I feel like it's too hard or I just think about what they were able to do, helping so many people. And both of them, their heart was serving the community. So both of them were in underserved communities, helping the poor. That's the legacy. And it really continues in Kansas City at a place called Samuel Rogers Health Center. That's one of the federally qualified health centers named after Dad. And he founded that over 50 years ago. So it's still going strong. I'm blessed to be on the board. So I continue, or certainly attempt to continue, that legacy.
What a wonderful legacy it is. So thank you very much for all you're doing. But before we started, you and I were chatting a little bit about the difference between functional medicine and traditional medicine. And I know your approach is functional medicine. So can you explain to our audience a little bit about the difference?
Absolutely. Well, I was trained traditionally. So I went to medical school, did a residency in internal medicine. And so I'm board certified in internal medicine. And that's what most people are used to. Your primary care doctor may be an internist like myself. And I practiced internal medicine for 20 years. And I was saying to Andrea that in traditional medicine, we're trained to ask the question, what is this? What am I seeing? And to give it a name, give it a diagnosis, and to treat it. And traditionally, that's with medication or surgery. So that's traditional medicine. Functional medicine, the approach is we really look at the total person. So we look at, we're made up of different things. We're physical, certainly, but we've got a spirit and a soul. So we look at the total person, but then we ask the question, why? So when people come to me and they say, Dr. Stanley, I'm tired, I can't sleep, my first thought is, why is this happening? What is happening at the cellular level? And so we're looking for things like inflammation, hormone imbalance, detox issues. We're looking for those root causes, those physiologic systems that are not functioning properly. And when we find those, when we test for those, then we're able to support. If your hormones are imbalanced, we're able to support your hormones. If you're inflamed, we're able to give you ways to reduce your inflammation so that you never do get to a diagnosis. That's our approach. We want to catch you early where you can still do something about it and then progress into a healthier lifestyle. So it's, I've done that now for 17 years, 20 years in traditional medicine, about 17 years in functional medicine. And I love both of them, but I can say that with functional medicine, I see people get better and it just thrills me and it makes me not want to stop. So I get now, kind of like why my father practiced till he was like 80 something.
Uh-huh.
So when you see people get better, it just keeps you wanting to move forward and help more and more people.
Wow, what a wonderful comparison between the two different types of medicine. And one of the things we're really wanting to talk about today, it's Diabetes Awareness Month. And so I'd like to ask you some questions around diabetes. And so I think everybody's heard the terms type 1 and type 2 diabetes. And can you explain what the difference between the two types is?
Sure. Yeah. Diabetes as a group of conditions is a problem with the way our body is able to utilize sugar. We intake sugar, our carbohydrates, as a form of energy. And the ideal situation is when we eat it, it comes into our body. Our pancreas produces insulin because insulin is kind of like a taxi. It helps get that sugar into our cells. And once
Okay.
the sugar's in our cells, then our cells use it as energy. So that's the best case scenario. When you have a condition called diabetes, type 1 is the one that is an autoimmune disease.
Okay.
And it's the one we see most typically in children, that for some reason their body has determined that their pancreas is the enemy. So
Oh,
it attacks the pancreas. So therefore they don't have insulin. And that's why type 1 diabetics have to be given insulin. Type 2 diabetes is the most common. That's what we see primarily in adults. Although, unfortunately, we're starting to see it more in young people because of the
oh,
obesity problem. But type 2 diabetes, you do have a pancreas. The pancreas is working and producing insulin. However, over time, our cells get resistant, like they want to ignore the insulin. And so you get these rising levels of sugar in the bloodstream. So that's
ah.
type 2, otherwise known as adult onset in the past. That's what we called it. And that's the majority of the diabetes that we see really around the world, but in this country. And then the other category you hear about is called gestational diabetes. And of course, that's in women, and that occurs only during pregnancy. And then it tends to just disappear after the baby is delivered. But that's the other group of women, other group of people that we see diabetes. So I'll talk primarily about type 2 today because that's the most common type.
Thank you for that definition. We have a
Mhm,
question from the audience already.
mhm.
And this question is, are women more prone to get diabetes?
Not so much. Statistically, I would say no. Now, women, and we don't fully understand why women get it, the women who get it during pregnancy only get it during pregnancy. We do know that a lot of the ones who have gestational pregnancies, have gestational diabetes in pregnancy, will go on to develop type 2 diabetes.
Ah,
Yeah,
that's interesting.
so they bear watching. And one of the things I'll emphasize today is, even if you're on here and you have no indication, no reason to think that you may be diabetic, it behooves you to get some sort of screening. I mean, every single person. I can't think of a group that should not be checked for diabetes, because what we know is by the time you get the diagnosis of diabetes, likely you've had some sugar abnormalities, glucose imbalances for 10 years, is what they told us in
Wow.
training. And so you want to be able to catch that early and get some things done early.
Great advice. We have another question, and that what are the symptoms of type 2 diabetes?
Mhm. Um, it's a list of them. Most commonly, people who have undiagnosed diabetes will just feel like they're urinating all the time, lots of,
Hmm.
just peeing all the time, or they're very thirsty, Or what I've always thought was fascinating is people with untreated, undiagnosed diabetes can lose weight. You say, why would they lose
Oh,
weight? Well, think of it like this. You can have all the sugar in your bloodstream, you can have a lot of it in there, but if it cannot get into the cells, it can't provide you with the energy. So a lot of people will lose weight when they've got uncontrolled, undiagnosed diabetes. Fatigue, some people they feel just foggy, just fogginess. But I would say the most common is around urinary changes, weight loss, generalized malaise and fatigue. Um, yeah, those are probably the most common.
oh, wow.
Mhm,
Um, I've heard the term pre-diabetes, and I've
mhm,
heard you mention that before. Can you tell me what
mhm.
exactly that is?
Sure. Prediabetes is a time frame, really, uh, before you actually get the diagnosis of diabetes. And you know what's so frightening about prediabetes is most people don't even know they have it. We
Mm.
know that there are 88 million people who have prediabetes. What we don't know is the millions of people who have it and they don't have any idea that they have it. So during prediabetes, you may not see the really elevated blood sugars.
Right.
So you may go to your doctor, get your once a year lab, and they say, oh, your sugar looks okay, or it was just a little bit high. When you hear that, my thought is that there's some things that people should do to follow through on that. And I'll talk about that in just a minute. But yeah, prediabetes is a time frame where you have some insulin issues, blood sugars that are not normal, but it just has not quite been captured, or if it has, your A1C, your A1C test, and we'll talk a little bit about that as well, is between 5.7 and 6.4. That's sort of the guidelines in terms of numbers. Or frankly, they have tightened up fasting blood sugar numbers. So
Oh,
really, anything over 85, can you imagine that? Just think about your own lab. Anything over 85 fasting consistently can signal that you've got some issues around insulin resistance. Not,
wow.
yeah. So, we just have to pay attention to that. And every person that sees me as a functional medicine physician, part of the battery of testing is an hemoglobin A1C, because I know A1Cs do not lie. And they give a picture of what your average blood sugar has been for 12 weeks
Oh,
prior to you coming to see me. So I can tell if it's over 6.4, well, actually, if it's over 5.6, if it's in that 5.7 to 6.4, then that's prediabetes. Um,
wow.
mhm,
We have lots of questions coming
good.
in the chat box.
Mhm.
And one of the questions is diabetes hereditary?
It can be. Absolutely
Yeah.
can be hereditary. And so, I'd say a number of people that I've seen over the years don't really have an idea of what their family history is. So it just behooves everybody to ask questions while you can still get answers from people. Then the other end of the spectrum that I see is people who know they have a family history and their family's been devastated by diabetes. But yes, it very much can have a genetic kind of familial pattern to it. So if you know it's in your family, you just really want to make sure that you don't have prediabetes. So
And
yeah,
how
I can mention
how
that.
do we go about getting diagnosed for pre-diabetes and diabetes?
Mhm. A couple of ways. Most commonly, people, will go to their primary care doctor or a
Mhm.
clinic. Or I'll be honest with you, there are lots of ways to get blood work these days that are patient directed and don't require, although I don't recommend this, don't require a doctor. But the ideal way is that you have some relationship, and you go in periodically, at least once a year, and they do a baseline set of labs. and they'll generally ask you to fast from the night before, about 10 hours, 8 to 10 hours of fasting, and you go have the lab done in the morning. So they draw your blood, they're going to measure your glucose level, which is blood sugar. They'll measure your glucose level, but keep in mind that that blood draw for glucose is a snapshot. So it's telling us what your blood sugar is in that moment. What I would look for, if I were you, I would ask the doctor, can we get a hemoglobin A1C? Because again, that's going to give an answer about what your average blood sugars have been 12 weeks before you show up for the lab. So it's a better reflection of what your blood sugar is doing day by day on average. So I would ask for those two tests, a blood sugar or glucose level and a hemoglobin A1C. And depending on whose standards you're following, any more fasting blood sugar that's over 126 is considered to be abnormal.
Excuse me,
Oh,
I have a tickle. Let's see.
yeah.
Is it possible to cure diabetes?
To cure, is it possible to cure? We don't use that word. No, we don't use the word cure, but it is certainly possible to go into remission or reverse it. No doubt about it. And it excites me when I like to empower people. So it's nothing worse than feeling like you don't have any control. I mean, we've been through that in the last couple of years with this pandemic, where you feel like, oh my God, there's nothing I can do. So when you are equipped with things where you feel like, okay, I've got this diagnosis, here's what I can do. I mean, that's the best thing that can ever happen. And it is clear in the science. If you go to American Diabetes Association, anybody who does diabetes is going to talk really clearly about ways that you can lower your blood sugar and your A1Cs. And to reverse it means that your A1C goes to less than 5.7. That's what and it's sustained. So you can do that. You don't have to look at your diabetes diagnosis as something that says, oh, well, it's just going to get worse and they're going to keep putting me on medicine. No, it doesn't have to be that. There are things that you can do that will stop the progression of it and get your blood sugars consistently down to where they do a fasting, it's less than 126, or an A1C, and it's less than 5.7. You can do that.
And I'm going to bring this up, everybody who's listening. How important is exercise and food to that process?
Essential. You have to do that. I say there's no easy way. Snap your fingers, but it is doable. It's doable. So that is how you reverse your diabetes. You do that with exercise, and they've determined that even 2 hours, walking for 2 hours a week, will reduce your A1C. It's proven over and over again. And there's no way around the fact that you have to modify and reduce your sugar intake. No way around it. When I see patients, I give them a list, I give them a table. The first column says eliminate, because that's how strongly I feel about it, or modify it. Eliminate or reduce, I'll put it that way. And those include potatoes, rice, grains like bread, wheat, pasta. Those things are always going to drive up your blood sugar. No way around it. Does that mean you can never have it again? No, it just means that you should recognize it and just do a trial. Do some adjustments as you're monitoring your blood sugars, because I'm going to tell you how quickly it happens when people say, I'm going to do this. I'm going to start walking. I'm going to identify the carbs and reduce those. Your blood sugar comes down pretty quickly. And you don't want to, if you're on a medication or insulin, you've got to know what your blood sugars are doing as you're making these important adjustments. But I promise you, and I've seen it over and over again, where people do that consistently and it gets better and their A1C gets better and they're down in a non-diabetic A1C range. So you can do it. It's very doable. And what you'll find is if you keep a log of those things and take it into your doctor, they're going to be excited. They're going to be happy for you. And they're going to work with you to, if necessary, begin to reduce some of your medications.
That is great. So
Mhm.
actually, correct me if I'm wrong on this, but I'm hearing you say that if you get put onto a medication,
Mhm.
you may not have to stay on it your whole life.
That's absolutely right. And I've seen this. I've seen this from personal experience with patients where literally, but let me, with this caveat,
Yes.
Metformin, and most people with diabetes, the first medication they were put on was a pill called Metformin. What we're finding out is Metformin has some other powerful benefits. So I must say that even once I get patients to a point where they can really come off their insulin, I will likely leave them on metformin because I know that it has some longevity, anti-aging properties.
Wow.
It reduces the risk. They've done studies that show that metformin can reduce the risk of certain cancers. So metformin has turned into more than just diabetes management. So while I may get people off of some of the other diabetes specific medicines, metformin, I'm tending to keep people on that because it has so many other benefits.
That's great.
Mhm.
We have some more questions in the chat box. You're getting lots of love, lots of people saying great information, and thank you, Dr. Stanley. Thank you for the information. One of the questions is, can you have your pancreas screened?
There certainly are tests that we can do to measure. There are certain enzymes and things that come from the pancreas. How do I want to say this? Yes, there are some tests that will determine whether your pancreas has lost, a certain amount of function and so on. We don't tend to do that in adults. Now, children, they'll start looking for certain conditions uh, to identify why, all of a sudden they have autoimmune pancreas disease and they've lost their ability to produce. But for adults, there generally is not any specific test to look at the pancreas because, to be honest with you, in adults, the problem is not with the pancreas ability to produce insulin. It does it quite well. The problem is we get so much insulin from the pancreas because we're eating sugar, 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 pancreas, insulin, 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 that your cells, pretty soon, they just get insensitive to it. They just don't respond to it anymore. You got lots of it. In adults, we don't see low insulin levels until we call burnout. I mean, years of having diabetes, but that generally it's too much insulin that's causing the problems. And causing it. Listen, insulin is a fat storer. It causes us to store fat, and
Oh,
that is antithetical. We're trying to get people to lose abdominal fat. Insulin causes fat storage. So in my mind, I ask myself, if I'm in that situation, okay, that doesn't make any sense. You're giving me insulin to help bring my blood sugar down, and it's necessary. Don't get me wrong. Some people need that. But over the long term, as a patient, I have to say to myself, if the insulin, which is supposed to help me, is causing me to gain weight, which is going to feed into the cycle, what can I do to reduce the amount of insulin that I need? Walk, reduce your carbs. You can still be satisfied. You can still have meat. You can still have a moderate amount of protein. You can still have fat. And that's a whole nother conversation, Angela, because we tell people low fat for 30 or 40 years. But we notice that during that low fat eat all the carbs you want to
Right.
eat. People got big and obese. So
Yeah.
all that stuff about, we know now that fat doesn't make you fat, sugar makes you fat. So I hope that answered the question. Yeah.
That was a great answer. Thank you. And here's a loaded question that I know that we do not have enough time today to answer. But what are the consequences of uncontrolled diabetes?
Excellent question. Excellent question. Here, I'll make it really plain. Keep in mind that when your cells become resistant to insulin, that blood sugar is still there, particularly if you're still eating it. So you still have a lot of sugar in your bloodstream. And what happens is what we call glycation, meaning over time, that blood sugar is not just going to float around harmlessly, it's going to combine with certain of your body tissues. So which then leads to inflammation, so that sugar is not harmless. You're not just peeing it out, it's in there creating havoc and creating what we call AGEs, which are aging glycated products that damage cells and lead to the complications of blood sugar. So we don't want that. We want to reduce those blood sugars as much as possible. And you can regain insulin sensitivity over time. The other thing that has been proven in studies to be very effective is to allow your body to move from dependence on sugar as your main energy source to fat, your own fat. So your body has this clever way of saying, okay, the blood sugar is limited. Let's go into the fat stores and use your own fat to be your energy source. And that's quite healthy. Yeah.
Wow. You're getting more love. This is great information. So people are really appreciating this conversation, as I do. And Dr. Stanley, we've come to the end of our time. Is it possible that you could come back and talk to me again, continue this conversation, maybe talk a little bit more about disparities and the complications?
Absolutely. I'd love to come back.
Thank you so much. I really appreciate you and all of the information that you shared. And thank you to those of you who joined us. We will not be having coffee chat the day before Thanksgiving, but we'll be back the week after that. Thank you, and I'll see you then. Bye-bye.
Right.